My name is Matt Blois. You're listening to Medically Necessary, a show about the healthcare supply chain. I talk with experts, business leaders, and researchers about how we get drugs, devices, and medical supplies to healthcare providers and patients. This show is brought to you by Ryder, the only fully integrated logistics and transportation provider in the industry. Ryder solutions cover the entire supply chain, including warehousing, transportation logistics, e-commerce fulfillment, and last mile. Discover how Ryder can make you ever better at ryder.com. Today I'm talking with Josh Komenda, the CEO of the non-emergency medical transportation company Veyo. And non-emergency medical transportation, or NEMT, is exactly what it sounds like. It's transportation service that brings people to doctor's offices, dialysis centers, or other non-emergency medical appointments that are also people got to get to. So this has been around for a long time, but probably in the last decade, listeners or viewers probably know that rideshare companies like Uber or Lyft have really changed what customers are expecting out of transportation companies. So Veyo launched in 2016 as a way to sort of bring some of those new improvements into NEMT. And so the business of the NEMT in a lot of ways is about bringing patients to medical care. But during the pandemic, a lot of people weren't going to get medical care, and in fact, a lot of medical care was going to patients. And so today, I'm going to be talking to Josh about what that shift means for NEMT, what kind of role NEMT plays in the healthcare supply chain, and just what's going on in that space. So Josh, thanks for joining me on the show today. Can you just start out by telling me a little bit about who would normally use NEMT and why do we need it?
Appreciate it, man. Thanks. It's so great to be here and great to connect again. So thanks for having me. NEMT is really an incredibly important and vital lever in our healthcare system that some of us really have no interaction with and don't know much about. So, for some of us, it might be the thought of how we get to a medical appointment is no more complex than hop in our car and drive there or ask a family member or a friend. But for so many Americans, that is really not that simple. So especially for a lot of lower income folks, they may not have a car in the family or have anybody that can drive them, or folks living with chronic disabilities. Driving might be impossible. Taking the bus might be impossible. And so, for a section of the population, NEMT is a vital service that really helps to make sure that they can get a ride that meets their physical needs or medical needs reliably to their appointments. And in some cases, it's for life-sustaining treatment, stuff like dialysis, where people have to be there 3 times a week, or getting to a surgery or a specialist or a primary care appointment. I think even as far back as the 1960s, the federal government recognized this. And so when Medicaid was created, Medicaid is our insurance plan for low income folks. And there's, particularly in Medicaid, this need is present, right? There's portions of the Medicaid population where this service is absolutely vital.
Yeah, that totally makes sense. And it does definitely seem like people who are on Medicaid, might be the same people who might have struggles getting to doctor's appointments or dialysis appointments, things like that. So I mentioned this a little bit in the intro. One of the we had a conversation a couple of weeks ago that I thought was really interesting about kind of what you guys have been doing during the pandemic. I know, one of the things you've been doing is basic NEMT, but during a viral pandemic, so you've had to figure out how to protect drivers, taking patients to doctor's appointments or medical appointments while they were sick. I know you guys have done a little bit with vaccines too. But one of the things that I've been interested in, one of the changes in healthcare that's been happening that I'm really interested in, is sort of the impact of telehealth. And I've been talking to a lot of people over the last couple of months about how there's even before the pandemic, there was a shift where, there was more and more medical care that was going to patients rather than patients going to medical care. And so I'm really interested in, NEMT, the way you just described it. It's all about I'm in my house, healthcare is over here, somewhere else. I have to get in a car and go there to get it. So if the pandemic is sort of speeding up this trend of more medical care going to patients rather than the other way around, what does that mean for a company like you, or for a company like Veyo?
Yeah, and I would agree. I mean, I think what we see is I mean, certainly during the pandemic, we saw a pretty big contraction of demand, right? So for many reasons, it's not times during the pandemic we saw ride volume kind of cut in half, very suddenly, very dramatically. It's been a slow climb, right? It hasn't bounced back quickly, especially because I think healthcare environments are perhaps one of the areas where people are most afraid to go back to, and especially for a lot of the folks that we serve who are living with chronic conditions and are potentially being extra cautious as well. I think our estimation is that's going to be somewhere in the middle, right? I mean, there's going to be there's definitely, and I wouldn't put myself as a clinical expert, but from clinical experts I'm talking to, there's definitely probably some compromises to care delivery that have been done in the interest of maximizing patient safety, but also that it will be time for some increased level of in-person visits in brick and mortar healthcare facilities. But I also think that the healthcare system is teaching itself that there is opportunities to serve patients better in the home, either with a hybrid model or more, increased use of telemedicine, et cetera. If I was thinking of ourselves strictly speaking as an NEMT company, I would say, yeah, probably our total addressable market's shrunken a little bit. But ultimately, I think that the larger tide is NEMT overall is finding increased use cases as a population health driver. So we're seeing more and more plans and payers think about value-added services and thinking about ways that NEMT can actually connect people to other health drivers, like getting access to food, fitness, and things like that. We're seeing additional non-Medicaid plans start to adopt and embrace NEMT as an optional benefit. So I think the market growth overall would kind of, sort of supersede maybe any kind of telehealth trends. But moreover, I see ourselves as more than strictly speaking an NEMT company. We think of ourselves as a healthcare logistics company, and especially during the pandemic, we found other use cases for our logistics capabilities that were able to respond really rapidly. So we had thousands of meals delivered on behalf. We partnered with Meals on Wheels to make sure, especially back in April and May during the peak of the lockdowns, that we were able to really get folks at need who are homebound, and also dramatically scale up the delivery capacity of Meals on Wheels. And to me, that kind of proved that we can work really well with healthcare populations that have a variety of needs and capabilities and need different types of assistance, and also not just move members, but also deliver services in the home. And we think there's some things we're researching and exploring right now are, for example, other types of potentially delivery of medicines, at home, simple, unskilled home care, but also potentially thinking about credentialing and training other skill sets, like off-duty paramedics or EMTs, that could potentially help with a variety of clinical applications, and really help enable some of these new delivery models that could be very valuable.
Yeah. Well, and it's interesting. I feel like that's the story I'm hearing from a lot of different people is about, like you said, it's not like it's all telehealth or it's all brick and mortar. It's all one thing. Like it's what I'm hearing from a lot of different people is that what the future of healthcare is really going to look like is there's going to be, certain things are going to happen over email, certain things are going to happen at the doctor's office, certain things are going to there's going to be all these different ways that kind of all work together to sort of, hopefully provide the best patient care. And I thought it was really interesting what you were saying about, there's, if you think about the word non-emergency medical transportation, you could constrain medical to mean only something where you're getting a medical treatment. But I think it's interesting that you mentioned, you brought up things like food, you brought up things like fitness, making sure people have access to that, or like you said, with the Meals on Wheels things, making sure people have bring that to people so that they have access to that. So I think that's a super interesting example. So I also wanted to ask about, well, I recently saw that you recently put out this press release. I was looking on your news site about hiring 1,000 new drivers in Arizona. And I think you guys are not in every state. I think you're only in a handful of states, actually. So I'm interested to know, like, why do you guys think that, like you were just talking about, the pandemic sort of contracted things and things are slow to build back up? Like, what's going on with the hiring of 1,000 new drivers? Why do you think what are you seeing that makes you want to do that?
Yeah, definitely. We have seen, as I mentioned before, like, demand kind of, I think hit rock bottom with the sort of the peak of the shutdowns, and it varied a little bit state by state, but back in last April and May. And we've seen a steady growth on top of that, and I think we're seeing, especially this year, as we're seeing some step functions and demand changes. So especially as the vaccine became, eligible or available to all age groups, more and more healthcare facilities are ramping their operations up and resuming some level of in-person visits. A lot of folks, some folks were able to get some level of care in telemedicine, but as I said, it's not been the optimal delivery model. Some folks have just had to delay care altogether. So between, just demand for in-person services ramping, we've been participating in a lot of vaccination programs as well, both drive-through and then also just taking people transporting to and from vaccination sites or their primary care provider. And then I think that combined with, and I'm not sure, if you've sort of been following an overall phenomenon really across the board of labor shortages. And so we're seeing some moderate level of demand pickup, but we're also I think, like a lot of industries and a lot of people across the board, as our entire economy has sort of come back online very suddenly, everybody's hiring, and sometimes the pipeline of available workers is a little bit more constricted. So we want to make sure that we are rebuilding our capacity, and we went from I think just before the pandemic, system wide, we were doing probably about 35,000 trips a day in our markets. That dropped down to probably at points below 20,000. Some of our network, kind of ramped things down. Some of our third-party providers parked vehicles and laid off some drivers, and some of our independent drivers, either took a break from work or moved on to other things. And so we have to make sure we're rebuilding our capacity ahead of demand, and in a tighter labor market. So we want to make sure we're really putting the word out. We're aggressively hiring, we're contracting with new drivers, and we want to make sure we put the word out that we're doing this in a big way for anybody who's looking for opportunities.
Yeah. Well, and it's interesting. I feel like it's sort of the quarterly earnings season right now. So I've been this week listening to a bunch of sort of earnings calls from public companies that are in the healthcare supply chain. And it sounds like a lot of companies are sort of in that stage right now of saying, okay, things, at least in the number of COVID-19 cases is starting to look better. Vaccinations are, at least in the United States, are looking pretty promising in some ways. And so they're like, okay, so now there's going to be this transition from sort of this trough in the pandemic to things are going to ramp back up in healthcare, and like people are going to come back. But it feels like it's a very tough thing to do, to look into the future and think, okay, when is it going to come back? And what rate is it going to come back? And how do you plan for that? I mean, it just seems like a really tough thing to plan for. It's just sort of an unprecedented situation. So it sounds like you guys are kind of doing the best you can and trying to stay ahead of the game in terms of planning for that rebound.
Yeah, absolutely. I think what's interesting, and certainly that challenge might be even more difficult for some companies that are hiring sort of specific, jobs for specific shifts and trying to balance that. I mean, one thing is, the nature of our independent contracted drivers really are independent people. They make their own schedules. And to some degree, our network is kind of forgiving to changes in demand, because if if there's not enough trips available, drivers can log off and do something different, right? And drivers can choose, and so they'll log on naturally when there's trips. And so our job is to just make sure we have enough trained, credentialed, certified, available drivers that are kind of active and ready to go. And then that network does adjust as demand changes.
Yeah, that totally makes sense. So also, I wanted to talk. You mentioned this earlier in the conversation that you guys have been doing some trips to sort of connect people with getting COVID-19 vaccines. And I think at some point I saw a press release with some stats about how many you'd done. I think it was a couple hundred number of patients that had done it at this point. But how do you guys see yourself as playing a role in the vaccination campaign, especially now that we're getting into this phase where it doesn't seem like the overall supply, at least in a lot of cases, isn't the problem. It's more like connecting people who really need it with a dose that's sitting there waiting for them to get it. I mean, among other things. But like, how do you see an EMT playing a role in vaccination campaigns?
Yeah, definitely. I don't have the latest numbers on me, but I'm sure we're well into the thousands now in terms of number of vaccines we've helped transport to. I also want to really recognize the efforts of our. We specifically developed a brand new model and billing code to support. I don't think any of us a year ago would have thought about a drive-through service being so vital for administering this, and so I really want to recognize the partnership that we were able to engage in with our Arizona health plans, as well as Access, which is the Medicaid department in the state of Arizona. Amazing responsiveness and innovation, figuring out typically we bill our trips are medical claims. They're for authorized services, and we have typically a trip to the doctor and a trip back from the doctor. But nobody ever really contemplated that the driver might be sitting there for 2 hours in line at a drive-through. And so, just an amazing responsiveness of working with the Medicaid department in Arizona and our health plans to figure out how do we create a proper claim for driver wait time and this whole process, and build an operational plan. Huge recognition to our team at Veyo, our tech team, in figuring out how to build a drive-through service delivery model, how to make sure train the drivers on it, make sure our members. And we've had some great success stories of members who've gone through that, and drivers that really understood, how potentially it could be nervous for members, or understanding the process and what to do and how to fill out paperwork and stuff like that. So we've had just some amazing drivers that have really rallied to the cause, and the program has been highly successful. So I think overall, it's been it's just sort of a one example of a number of different ways that we've had to adapt our operation models, our processes, our technology, our billing, everything else. Yeah.
Well, and it seems like, one of the things I thought of when I saw, when I was reading a little bit about what you guys have been doing around vaccinations is I was thinking about, it feels like we're at a point where for people who have an easy time getting to a vaccine appointment on their own, as long as they're enthusiastic about going and doing that themselves, they've likely gotten in their own car and driven out there to go do that. But it seems like also it'd be interesting, like if I was the state of Arizona, if I was a county, or if I was one of these organizations that's trying to get people vaccinated, I might look at sort of the data that you guys have too, in terms of like who's using NEMT services as almost like a list of people who might need help getting a vaccine, if they need help getting to medical appointments, in their normal life, it seems like that would be a useful indicator of like, maybe these are people that kind of we should be reaching out to and need help to make sure they get help getting a vaccine. I mean, have you guys been communicating with anybody about like that kind of stuff, or working with patients who have used your services before to kind of help them or encourage them to go get a vaccine at all?
Absolutely. I mean, one thing that we fully have been discussing at length about just how we can make sure NEMT can be used as a really important tool to remove barriers to vaccination. I know it's not it's not a huge proportion of the population, but I've read statistics of anywhere from 7 to 10% of the population says the main reason why they are not able to get a vaccine or they haven't been able to get one is because of transportation. And that's a big number. I mean, it seems like, okay, it's a single digit percentage. But that is, pretty close to the delta between where we think we're going to land in terms of the population and where we need to be for closer to herd immunity. So closing that number down is a huge, I think, imperative for our health systems. I mean, Veyo itself, we don't, of course, because we're delivering, Medicaid services, we never induce demand. We don't go out there and encourage or prospect for trips or services, but we do engage with our health plan partners to make sure that we're at the ready and our members are well informed, and work in partnership with the plans and the regulators to make sure we're there and ready as they sort of launch these public health campaigns to get people vaccinated. And we think it's an incredibly important tool that we're there and we make the process as easy and frictionless as possible for members. A lot of our folks that we regularly transport, I mean, they are seeing healthcare providers on a regular basis. And we know, I mean, even though, maybe we've done a few thousand trips approximately explicitly just for a vaccine, a lot of those folks are getting vaccines as well at other healthcare appointments, right? So they've been booked to go see their regular primary care physician or other specialist, and they're getting a vaccine at those appointments also. And then, I think so. So in addition to making sure that members are well informed, that this is an option available, providing we have a weekly collaboration call with most of our plans, and sort of explore what are other things that we can do to make this easier, change our messaging, just to make sure members know this is available to them.
Yeah, great. Well, I'm going to wrap up with the last question. It's the same question I ask everybody at the end of the show, which is, if you had one wish, no limits whatsoever, it's just you have total magic wand to change whatever you want. One wish to change the healthcare supply chain, what would you want to wish for?
Wow. I think I always say I'm thinking a lot in terms of NEMT, and I think one thing is I understand that change in healthcare happens slowly, and there's often good reasons for that. We have to be cautious and make sure we're not exposing or putting any vulnerable members at risk. But I guess I had one wish, that if we could figure out a way to safely collaborate even faster. I think there's some exciting changes on the horizon with care delivery models that's going to drive sort of the quadruple aims of our healthcare system and improve lives, outcomes, costs, efficiencies. And I wish there was a way for us to think tank things better and get a way to bring new models and pilots to the marketplace faster. Yeah. Well, and I hope. I like the idea of I wish there was a way to think tank things faster, because I feel like I hope that's maybe some of the value that a show like this or a newsletter like Medically Necessary is bringing, is sort of like you said, you look at things from an NEMT lens, and I just talked to somebody else just not that long ago about laboratory logistics and doing things that way, and just I'm hoping to sort of bring in all of these perspectives into one place so that people can read the newsletter, come up with new ideas, and make the healthcare supply chain better in some ways. But hopefully there's a place to do that. Whenever it's safe to do so, you got to host a summit for us all so we can get together. Yeah, there we go. That's what I'm talking about. Great. Well, that's all the questions I have for you, Josh. I really appreciate you joining me on the show today. I thought the conversation was really helpful, really insightful. And so I hope the listeners got a lot out of that too. This has been Medically Necessary. You can catch the next episode on next Thursday. So thanks a lot.